Hi, my name is Shauna Spears, and I am presenting some information about counseling older adults. This is for a multicultural class at Houston Christian University. To begin, we're going to talk about the importance of counseling older adults in regard to multicultural counseling. Older adults are a part of every community and culture. There are multifaceted ethnic backgrounds, cultural identifications, and religious practices that a counselor needs to consider when they're with a client. While most of the Western world is individualistic, we have to understand that for many other cultural backgrounds, this is not the case. They instead are focused more on their families and communities, and they consider these to be the most important things. So, in these collectivist cultures, it's common to see that older adults are often respected and cared for. This can be really empowering for these individuals, but also it can be difficult to overcome larger society's norms, which, oftentimes will belittle older adults. They will discriminate against them. And so these things that are happening can actually be detrimental and hurtful. That's for any older adult across the board, whether they come from a collectivist background or an individualist background. Stereotypes, discrimination, being talked down to, all of these things can really hurt an individual. And when an older adult is able to receive counseling, either for individual, group, or family counseling, there is a wonderful opportunity to see benefits such as improved coping skills, some social opportunities, which are incredibly important later in life, overall improvement of quality of life, and a feeling of autonomy. Now, some essential elements of counseling older adults. We need to understand the demographic growth. The population of Americans over 65 has been continuing to grow, and it will continue, likely constituting about a 21% population in 2030, according to SUE, the SUE textbook. So we need to understand that this is not a group that deserves any sort of minority treatment. This is a big deal for all cultures and societies. So we need to take the time to understand these individuals and not to ignore them or demean them. As counselors, we of course can fall victim to and make mistakes regarding how we treat others, especially these older adults. We need to be cautious in how we interact with our older adult clients. We need to show them respect, avoiding ageism, elder speak, and stereotypes. We also need to avoid and pay attention to, of course, neglect and abuse. This is something that is unfortunately prevalent in our society and can often be overlooked or mistaken for something else. So we need to be aware for our clients, especially those in a vulnerable position. Of course, we want to honor and respect the client's culture, as I previously mentioned, because this is a huge part of who they are. We don't want to move something that is so important to them to the side because there may be opportunities for healing and growth in that culture that we need to pay attention to. We, of course, need to have a sensitivity to intersectional issues. So when we consider an older adult client, we don't just look at them with understanding that maybe they're depressed, but we want to consider what else is going on. Is there any sort of addiction? Is there any sort of abuse? Is there what's going on with the family? We need to pay attention to all of those things. And in cases of depression and social isolation, counselors need to take care to act upon these concerns immediately. And we need to work to understand the factors and situations that are contributing to these issues. We don't want to overlook them. This comes from an article, a recent article by Laborde. So it's important to note that there are a number of different evidence-based therapies that we can use for our older adult clients. Some of the ones that were recommended in my reading was cognitive behavioral therapy. There's interpersonal therapy as well. And of course, there is all kinds of information coming out from the American Psychological Association, where they have different things listed in their code of ethics as well. So we need to understand that the majority of older adults do not demonstrate significant mental decline. I think this is incredibly important because these individuals should not be looked down upon because of their age. They are strong. They have a lot of wisdom to share, and we need to take the time to be patient and seek out their wisdom, seek out their knowledge of who they are, not stepping on their toes and being disrespectful. I read several different articles and, of course, my textbook in order to compile this information. And I would agree with everything that I have read. For instance, mental health care for older adults is multifaceted, as I've mentioned several times, and various factors need to be assessed. We need to consider their culture. We need to consider their family. We need to consider who they are as an individual. Because when we understand them fully, we are able to be a better counselor for them. We're able to really partner with them in a strong therapeutic alliance and work through the situation that they're presently in. Something that really stood out to me from my reading, and this came up several times, is that depression is not a normal part of aging. We do not need to see an older adult and expect them to be depressed. We don't need to see an older adult and expect them to be struggling. They are incredibly smart. They are active, engaging in society. They want to be in everything like they've already been most often. And so we don't need to look down on them. We don't need to expect them to be suffering. But when they are, we need to be there for them and with the best attention that we can give them. And something I really appreciated understanding as well is that social engagement is important and it helps older adults combat that cognitive decline. And that is a part of life as we get older. We know that we will often struggle with memory and recall. So when we allow or when we make it possible for these older individuals to have a social gathering, this is going to help them improve. So I really appreciated reading about this, and I think this is a great opportunity, for us to consider group counseling for older adults. Of course, there are many factors to determine whether or not a client would be right for that group, but there are so many things that we need to not neglect when it comes to the care of our older adult clients. So I do agree with everything I've read. I think there's been great information, but of course, we need to continue to gather more information, to do more research, and to really treat these individuals with the respect that they're due. These individuals are not a burden to society, and they should not be treated as such. In conclusion, I believe that it's important for counselors to be prepared for any client that they have, but especially regarding older adult clients. I feel like we often look at someone's age and make quick decisions, but this is not what we should be doing. We need to be curious about the individual before us, or the family before us. We need to treat each and every client with respect, and we need to honor their background, their history of who they are and what they've brought what has brought them up to this point. So with older adults, because of the way society is often neglecting them, treating them poorly, I think it's incredibly important for counselors to fight that and to truly be present with our clients. We need to make sure that we understand their needs well. We need to consider their physical limitations and maybe the work that needs to be done with their medical provider. We need to understand that there could be cognitive limitations, that these are normal, but we need to know how they are affecting the client and what we can do about that. Again, we need to be considerate of elder abuse, pay close attention to neglect or anything that may suggest that some wrongdoing is taking place. We need to watch for substance abuse. This is not something that the older adults do not struggle with. In fact, it is a struggle. And these things can also build into social isolation, depression, and suicide. Like every other client we have, there are needs, and we need to pay attention to them. These are the references I have used for this presentation. There are 2 articles first listed, and at the bottom is the textbook from this course. Thank you so much for your time, and I hope you have a wonderful day.